This is my audience for today. Have you ever had a headache or inflammation or swelling? If so, you've probably used an NSAID without even knowing it. According to PLOS Medicine, NSAIDs are among the most widely used drugs in America. So now I'm going to teach you what NSAIDs do, and I'm credible in this because I'm a nursing student and this is what I'm currently learning about in school. According to rheumatoidology.com, NSAIDs block enzymes in the body that help make prostaglandins. These are chemicals that play a role in pain and inflammation. So what NSAIDs do is there's a substance in your body called arachidonic acid. This will convert to what is called cyclooxygenase, and there are two types of these, which we will call COX-1 and COX-2. After this acid converts into COX-1, it turns into prostaglandins. Prostaglandins promote GI cytoprotection. This is what helps your stomach produce mucus so that your acid, since your acidity level is so low, it prevents it from damaging the inner of your stomach. Then it also helps with platelet aggregation, so when you get a cut, this is what helps form clots and to help it stop bleeding. It also promotes renal blood flow, so it helps your body get all the blood to all your organs and helps it excrete the drug itself. Then if we look at COX-2, it helps promote inflammation. Inflammation occurs when you get hit really hard so that your body sends out this system and it sends white blood cells to prevent infection. In pregnancy, it helps with uterine contractions. So when it's time to give birth to a baby, this is what helps it produce. Again, it promotes renal blood flow and it helps vasodilate your blood vessels, so it just makes them get bigger. Now we're going to go through, since you know what they do, we're going to go through what phases it has to go through to become a drug on the market. According to Laney, which is one of my medical drug books, there are 4 phases that each drug must go through to be put on the market. Phase 1 is where they test it on animals. Now this is inaccurate because animals and humans don't have the same makeup, so it doesn't really tell a whole lot. Then if it passes that, it goes on to phase 2, which is where they test it on healthy humans. This is where they test for side effects and how it's metabolized in the body. The third phase is where they test it on sick people. This is also inaccurate because they only test it on the specific, what the drug is supposed to do. So they're basically just making sure the drug is working in the body how they want it to. Phase 4 is when they put it on the market. The data, after they go through all the phases, they have to send it to the FDA, and the FDA will approve it, and then they'll put it on the market for MDs to give to their patients. And this is where you find the most adverse effects because you're dealing with people that have several different illnesses rather than just one. When they're testing them and putting them through all these phases, they are testing for different things. One of the things they're looking for is effective. So how well does it work in the body? When will it start to take effect? How long will it last? How long will the effects last? And this is the most important for healthcare providers especially, because if you don't know how the drug works, you don't know what to look for. The next thing is safety. So how safe is this for the patient that you're caring for? One of the things that we talked about in class is how the prostaglandins they're rated a category X for pregnancy. So what they do, if you give them in pregnancy, they will stop your contractions. It also is given in infants after they're born to shut one of their arterial valves. And if you shut that while they're still in the mom's womb, it will stop their circulation so their blood can't get through their body. The next thing they test is selectivity. So does it block one COX or does it block both of them? And that will produce a different effect in each person. The next thing they test for is reversibility. So IV drugs don't have any reversibility because it's put right into your bloodstream. The only thing that I can think of is like morphine has one antidote. Otherwise, I don't really know of any other ones that have any. The next thing is its predictability. So can you predict what it's going to do in your body? The less predictable it is, the less safe it is. Does it have any drug-to-drug interactions? Can it be compatible with other drugs you're taking? And does it have cost effectiveness? Can people afford this drug? I hope you enjoyed learning about NSAIDs today and how they work. And just remember to never take a drug unless you know how it works in your body. Thank you.